Is it possible to do hairline lowering on one side of the hairline? I asked a question regarding follicular unit extraction last week, and I'd like to thank the doctors who replied to my questions. The responses were very helpful and informative. For the record, I'm female, age 29. In photos, my forehead looks worse than it actually is. I'd rather not make a drastic change since I'm okay with the height of the left side of my forehead, but not the right side. Would the surgical method or the transplant method be better for one side?
Thank you for your question. You've submitted a question as a follow-up to your previous question regarding a choice as to how to improve the hairline as you perceive it. And you're a woman who is 29 years old, and you're basically concerned about the difference on the right side compared to the left side. And you're asked about whether a surgical method versus a hair transplant technique would be better. Well, since I do perform both types of surgery, I think that I can be unbiased and tell you that the ideal for you is most likely to be a transplantation. And with the understanding, you can make a decision about how to undergo the type of transplantation you desire. So let's take this opportunity to understand a little bit about the realities of hair transplant surgery. So if you want to lower the right side of your hairline and you want to make it more symmetric, well, you have to achieve a certain amount of density and a certain amount of space to be covered. So when you do your consultations, you'll get a few different opinions on what would be ideal for you. One thing that is often overlooked during consultation is not so much the number of grafts that are needed, because for every square centimeter there's a certain amount of grafts necessary in order to fill in that right side of your hairline. But something that hair transplant surgeons don't speak about very often is the survivability of those grafts. Now, this is something that it will be, of course, in your consent, but it's something that you have to really understand to appreciate what the game plan for you would be as far as your transplantation is concerned. I think that it is likely, and from my clinical experience, that you will need about 2 sessions separated by about a year apart in order to get the maximal volume and density you desire. When you look at hair transplant surgery in terms of how people measure results, very often you'll find this one-upsmanship game that where certain doctors will say they'll do X number per square centimeter and others will say I can do this many numbers per square centimeters. Well, it's not about the ability to do the surgery. Any technically competent doctor and a team of technicians, which is how this is done, can place as many hairs as is physically possible. But the question is, will those hairs survive? So this is something that we have a lot of experience with, and we have been able to help a lot of our patients with transplantation using something that is relatively new to the hair field called hair regeneration. What we have been doing is we have been combining a material called extracellular matrix with platelet-rich plasma. This is your own blood spun down, and the critical healing factors derived from the cells and plasma. The cells are the platelets, and these are the cells needed for wound healing. What we're doing is we're using this technology that we've developed over the past several years to enhance and maximize the survivability and the thriving of the hairs that are transplanted. We have seen in people who have come to us from all over the world, people who have had mega sessions, very large numbers of hairs being transplanted, and they've had a 90% loss. So this subject is not to be taken lightly. Your situation is actually, a lot of it is in your favor. Since you're dealing with a limited area and you're not like, and you don't have an issue with hair loss at this point of your life. So certainly you have more than enough donor area in order to transplant the hairs, but I would advise you to look very critically at the opportunities to maximize every procedure you have. Even if you need 2 procedures, it is best to maximize the survivability of the grafts. Another thing to also consider is to think about the future. Now, if this is something that the way your hair appears is natural and it's always been like this and you've noted no receding, then there's a good chance this appearance will be stable for a long time. If you notice that there's a family history of where the women start to get the progressive temporal hair loss and thinning, then you might want to consider that in factoring in how you do your procedure. I think that it is ideal to not be too aggressive. When we do our transplantation in cases like yours, we actually start from the back and we feather forward. This way, as you heal and the hairs grow, it doesn't look so sparse. Even though during surgery it can look very close together, compared to what nature creates, these transplants can look a little bit artificial until you get a second procedure. So be mindful of that. So again, your best option from my perspective is to do a hair restoration procedure or hair transplantation procedure. Learn about the options to maximize the results in terms of survivability of the hair grafts. Learn a little bit about hair regeneration and the use of extracellular matrix to enhance the healing process. And I wish you the best of luck. I hope that was helpful. Thank you for your question.